Hey everyone, it's Janae again with Daily Dental Hygiene, and today we're going to be talking about professionalism. This is super important. This is something we deal with on a daily basis, and this is literally the make or break of you keeping your job sometimes. Politics, religion, and COVID are hot topics. You know, when I went to school, COVID wasn't a thing. There was no COVID vaccine. It was just barely coming out. We didn't know if it was a flu or if it was going to be serious and deadly like a plague. And so it was one of those things that was just happening. And so we didn't really truly get into it at school and, kind of discuss it. And now I'm out in the real world and absolutely I deal with COVID questions on a daily basis. So today we're going to go through those three topics: religion, politics, COVID, how to stay professional, what to say, what absolutely not to say. And this will kind of be like your survival guide video. I want you all to keep your jobs. I don't want any of you guys to be in trouble. I don't want you guys to ever be put in an uncomfortable situation, because as much as you think patients have self-control and won't ask you extremely personal questions like, what's your religion? They have no self-control. They have no manners in the dental chair. It's unreal. I know. I never thought that I would have people ask me the things that I have been asked, but they do. And I don't want you to be a deer in headlights feeling uncomfortable. So we will take it from my own personal experiences. So the first thing I'm going to talk about is religion. I have had patients literally in my face say, "How's your walk with God today, Janae?" Okay, well, let's go there. But first things first, oral hygiene, that's what I'm here for. I'm a dental hygienist. So my rule of thumb is in dentistry and, at whatever job that you might ever have, if it doesn't pertain to that job, it doesn't need to be talked about, right? I'm here to clean your teeth. I'm here to help diagnose, help, implement oral hygiene. I'm here to get you on track and get you in a better health position. So religion, politics, and COVID doesn't obtain and that doesn't matter about your oral health. So it doesn't need to be talked about. And so that's how I basically have, covered myself and have been able to stay on the track of being professional. So back to religion. I did have a patient once ask me how my walk with God was. So I was a deer in headlights, and it was a little uncomfortable, because even if I am religious or even if I'm not, you don't really expect someone to kind of get in your face and ask you something uncomfortable like that. So this is what I ended up saying: every day is great and I am truly blessed. That's a broad statement. And then she smiled and was like, "Oh, great," and got into the chair. I didn't say anything about my religion. I didn't say if I even was religious. I completely sideswiped into a different line to avoid uncomfortable confrontation. And that's basically what this whole video is about, is how to use different verbiage in order to stay professional, but to get back to what is important, like you getting in the dental chair and me, doing oral hygiene. So we don't need to get off topic and start talking about religion, politics, COVID, none of that, because it's not important, like I just said. So keep things short, keep things off to a side, and stay on track, which is the hour, the 2 hours, the whatever amount of time that you have this patient for and what you need to get done. So religion, I have had patients literally say in my dental chair, "If you voted for Donald Trump, I don't want you in my mouth, because I don't want an idiot like somebody who would vote for Donald Trump in my mouth." Okay. So that's a really intense statement, right? And that's like, wow, okay, we just went there, and it's Monday at 8:15 a.m. So let's get into that. Like I said, if you keep the mindset that if it doesn't matter and it doesn't pertain to your oral hygiene, I'm not going to talk about it. I'm not going to say if I voted for Donald Trump or Biden, if I didn't vote at all. I'm not even going to get into it because it doesn't pertain. So when I had a patient like that say, "All right, well, good thing good thing that I'm not an idiot then. I didn't say if I voted or not for Trump, but at the end of the day, I don't ever want to put myself in an uncomfortable position. And there's a huge mentality in dentistry. You can do anything for an hour, right? Who I voted for is completely irrelevant. That doesn't make me a good or a bad hygienist, so it doesn't matter. And I have kind of learned to pick up on the feedback of different people. Like, oh God, did you see what Biden did today? Boom, now I can pick up that person doesn't like Biden. So then you just morph and change your views and stuff to make people feel comfortable. Because at the end of the day, I would rather say that I voted for Donald Trump so that my patient gets good oral hygiene and I got to clean their teeth today than to fight with them about something like that. I know that sounds like you're giving power away, but at the end of the day, you're being the mature adult, and that is truly what's important, not who you voted for. So if someone's like, don't you think Biden is super stupid? Yeah, Don't you hate Donald Trump and that new policy? Yeah, So I notice there's a little bit of bleeding right here, and I'm kind of getting a little bit of plaque in between here. Boom, tailor it back into what's important, that appointment and doing your dental hygiene. I just basically morph, and maybe this isn't everyone's ideology, but I basically morph and tailor my personality and my beliefs and stuff to different patients just so I keep the appointment very mellow and very calm. You don't think a patient will complain about you, but they absolutely will. Like I said, I have had patients say and do crazy things. And so you don't want to make yourself in an uncomfortable position. You also don't want to lose a patient on your schedule or have a patient say that they never want to go back to the practice and see you because you voted for someone or because you have this religion. So keep things very, very neutral so that you are not ever in an uncomfortable position, because I literally have seen people get in trouble and lose their jobs over not being able to control their personality enough to keep politics, religion, and COVID on a down low. And there have been patients that have complained and said, I don't want to be seen here. That was an uncomfortable, appointment. And I felt like that hygienist was, talking all about this. And that's a shame on them. They really should not have. They should have kept the appointment very neutral and should have kept it back to dental hygiene. And they weren't able to control their own personal beliefs to make it about that patient and what was truly important. Don't be that dental hygienist. So the third topic is COVID. It is very, 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 very sticky situation with vaccinated versus non-vaccinated. And regardless of what you are and your personal beliefs and if you're vaccinated or not, like I said, it's all about the oral hygiene. I have had patients say, you're not one of those anti-vaxxers, right? Perfect response. Just got to do whatever makes you feel safe. I didn't say if I was vaccinated. I didn't say if I was unvaccinated. I said it's smart to do whatever makes you feel safe. And that's a very neutral answer. And then you can go and dive right back into your hygiene. Boom, bring it right back to what's important, your teeth. So why I'm bringing this up is because you're going to be in different offices. So, for example, I temp all the time at different offices. There are some offices that are literally like temperatures. They do the questionnaires. They do the pre-COVID rinse. They, have you wait in your car and call you when it's time for your appointment. I also have worked in temp ed offices that are acting exactly how they acted three months ago, 3 weeks ago, 3 years ago, and nothing has changed. And you might really, really like a practice and then be like, oh my gosh, they are super intense about COVID, but I really like the dentist and I really love the patients here. So be able to be flexible and keep yourself open. You might be in a situation where not everyone in your office is vaccinated, or there are going to be people that will be unvaccinated, and you also don't want to throw anyone under the bus. For example, when a patient asks you if you're vaccinated or if you're unvaccinated, a good way to kind of go around that is to say, due to HIPAA and, patient information, just like yourself, we at this office value, our workers' private information. And so as a result, we're actually not legally allowed to disclose who is vaccinated and who's not. And so I can't disclose with you that information. They can't argue with that. And then I even tell them, your information is also the same way. I am not allowed to legally disclose any of your medical history with anyone else if they were to ask. And so it's the same here at this office. We care about, the protection of privacy and information. And so, that's our policy. And especially when I temp at different offices, I don't know everyone's office, if they're vaccinated, if they're not vaccinated, if half the staff is, if the other half isn't. And I'm absolutely not going to say who is if I do know. You might be at a practice, for example, as a hygienist, where they might have 4 dentists. 2 of them are vaccinated, 2 of them aren't. And you don't want to be the person to say, oh yeah, they too are vaccinated and they aren't. Because that patient might say, well, I only want to be seen by someone vaccinated. Or I don't want spike proteins. I only want to be seen by the people that are unvaccinated because I don't want, the vaccine to put spike proteins on myself. You've now just put those different patients and those different doctors in very uncomfortable positions. So keep yourself professional. You never want to lose your job. You never want to not have a patient want to see you. You never want to be in a position in which you're in trouble. It's not fun having a one-on-one conversation with a dentist, especially about professionalism. I want you all to have great, dental experiences. So with that being said, always keep the mindset and always keep the mentality that I work and I talk about what is important to my patient to get them on a better oral hygiene regimen. If it doesn't pertain to your oral health, we're not going to talk about it. If they bring up religion, politics, or COVID, quickly shut down the comments by giving them a neutral comment and then directing it directly back to their oral hygiene. Boom, I'm seeing plaque on the distal of this one area, and then you show them and now we're talking about something different. You need to be able to do that, because the more you give them opportunities to talk about things like politics, religion, and COVID, you're opening the door and they feel comfortable and safe disclosing all of that information to you and all of their opinions. And they shouldn't feel safe like that because it's not appropriate. So the more you allow them to talk about it, the more they are going to dump onto you because they feel like you are a safe space to unload all of their beliefs. And operatories are small and there are people in other rooms and things echo. So don't ever be unprofessional in that way.